The Libido Doctor is in.
Hello and welcome. This is Dr. Suzanne, and I just want to briefly talk about one concern that I see in a lot of patients, which is a protruding abdomen or tummy in women, especially after having a lot of children. I was talking to a patient who was complaining of uterine prolapse and explaining how she had so much pain during intercourse with her husband, she didn't know what to do anymore. So this patient has 6 children, and among her children she had a set of twins, which tells me that the pressure on her uterus was so much that the ligament, got laxed. Now she has a prolapse. Prolapse only means that the uterus is protruding in the vagina a little bit more than it should be. What is the solution? If you have a uterine prolapse, the solution is surgery. She needs to get the surgery to pull her uterus back up in place, and that's going to help with the pain she's having during intercourse. But sometimes when you have a protruding stomach, right, after having a lot of babies, you just feel like, oh, it's too hard to lose weight. It can also push on your uterus. It can push on your bladder, and it's going to give you some degree of incontinence. You will have urinary incontinence, like you coughing, you lose urine. You laugh too hard, you lose urine. And sometimes you can even lose stools because the tummy is pushing on the rectum, the uterus, and your bladder. Sometimes you can also have a lax vagina, meaning that it's not firm and tight anymore, and you can have instances where during intercourse with your husband, your vagina is making noises, especially depending on the position that you guys use during intercourse. But for the tummy, let me just give you a few tips that you can start to do now. The first one is to use probably a pregnancy belt that's adjustable, and you can pull your stomach and you can also tighten it a little bit. Okay, that is going to take off some of the pressure your tummy is putting on your pelvis. The second thing you must do is your Kegel exercises, where you strengthen the muscles of your pelvic floor, and you hold for a minute and you let go for 30 seconds. Sometimes you can hold for 3 minutes, but you have to do those exercises multiple times a day, especially when you're sitting down. If you work, you're at your desk, always remember to do your Kegel exercises. That's very important. The other thing you should do is to begin to find out ways to empty your abdomen, your intestines. You could use a blend of vegetables that will help you use the bathroom more, mixing papaya with beet, ginger, lots of water. It will help you soften your stools and use the bathroom more. You will feel lighter. The other thing you can also do is to do drinks with ginger and lemon that you take every morning before you eat, and probably skip breakfast and eat your lunch a little late, so that you give time to the beverage to work in your system and begin to break down all the food that's stuck in your abdomen. And why not start doing some exercise? Exercise can be as easy as walking. You don't have to start running if you've not exercised for a long time. You can work a short distance, maybe 15 minutes to go to one point, 15 minutes to come back. You first start once a day, then you do that twice a day. If you have steps or stairs in your house, you can go up and down the stairs maybe 10 times to help with building up strength and start changing your heart rate. Those are the little things you can do. And then when you are intimate with your husband, if you have pain because when he goes in deep, you feel that he's hitting on your cervix because you have uterine prolapse, you need to change positions. One of the easiest and best things to do is to lay on your side and give him your back. You know, like when you're pregnant, that's one of the favorite positions. So what that we do, it will prevent that deep penetration that hurts your cervix. You should also avoid having positions where there will be super deep penetration to hit on the pelvis. The other thing your husband can do during intercourse is to make sure that he stimulates you, your breasts, your clitoris, and your G-spots to cause you to have orgasms before he does the penetration and tries to get the vaginal or the cervical orgasm. All right, so those are the few tips. But a lot of mothers who had multiple children and find themselves with a tummy that's a little large, it can actually cause you to have incontinence, laxity of your vagina. But there are solutions. You just have to make the decision to work on that, okay? One is to have a belt. 2 is to do your Kegel exercises. 3 is to use fruits and vegetables to empty your stomach. 3 is to start exercising. 4, start exercising. You go progressively up to the point where you can actually do some, heavy work and things like that. Give yourself a year, at least a year, to lose that belly fat. But it can happen. Now, there are other techniques that are more invasive. You can do liposuction, you can do a tummy tuck, and you can also do laser to remove belly fat. It's something that I do with my patients as a support for weight loss, and it works pretty well. But usually you have to add exercise and beverages to burn the belly fat. Okay? So those were some few quick tips, and this is exactly what I taught my patient to do, and I will continue to monitor her and encourage her in her wellness program. All right, this was Dr. Suzanne, and I hope you're having a great day. Bye.